wait till people get sick and debilitated before we see them. And Donald, isn't it ironic that we call it health care? It's not health care, it's disease care. We wait till people get sick and then we treat the disease. We really don't teach people how to stay healthy.
Sick care.
Yes. In the wellness model, we teach people how to stay healthy and avoid the doctor and avoid the drugs and avoid the hospital.
Now, you're not one of these doctors that will just prescribe drugs at the drop of a hat. So many people go to their doctor, all of a sudden they're writing them a prescription that they have to stay on for the rest of their life.
You know, Donald, I'd be remiss if I didn't tell you that the drugs that I've used in the intensive care unit and the emergency room, they've saved people's lives. They're very important when you really need those drugs. But make no mistake about it, especially when we're talking about the prevention of problems in the first place, I try at every turn not to use drugs and medications. I try to use natural alternatives because I subscribe to a credo that basically says that I don't believe anything was created in this universe that there isn't a natural countermeasure to.
So you think there's natural ways to prevent or even potentially reverse disease?
Absolutely. Remember, disease, the word disease, the very conditions of diseases, those are natural.
Well, we're here today to talk about heart disease. I think still the #1 killer in America. I think it's neck and neck with cancer.
You said it, and the word is still. It is the #1 killer of all Americans, men and women, and that's a staggering statistic. And if you think about it, and you really stop for a moment, it really blows your mind because here we've thrown the gauntlet down with terrorism, as being this killer of Americans. But the #1 killer, it did nothing. Everything else dims in comparison is cardiovascular disease.
How many people are dying each year with heart disease?
The number of people dying each year of heart disease, it's a staggering statistic. You can get online and look at it through the Center for Disease Control, and these statistics are available to everybody out there. Over 910,000 deaths every year from heart disease, from cardiovascular disease. 910,000 at least that we know about. Now let me tell you, that's one death every 35 seconds. So by the time I take my next breath, another person will have died. One every 35 seconds. It is a staggering statistic.
Why is it so epidemic?
Well, let me tell you.
It's worse in this
I'm going to tell
country
you
than
why.
other countries.
And that's another statistic. If you take that statistic of almost 1 million people dying every year from heart disease, superimpose that on another statistic. More than 70 million people out there are walking around with cardiovascular disease and don't even know it.
Now,
Many of them
what would be some telltale signs that someone may have heart disease?
If you are fatigued out there, if you trot up a couple of stairs and you're short of breath, obviously if you have any pain in your chest, if you have any of those things, just low energy states, then you have to carefully look at your physical conditioning. You have to see your doctor. You have to look into it, and you have to find out what's going on.
What about high cholesterol? You go to the doctor, he checks your cholesterol, he says, oh, you have high cholesterol. Is that a telltale sign that you're on the road to having heart disease?
Certainly that's a component. A high cholesterol is not a good thing. But you know what? If that were the answer, if it was just about the cholesterol, we've got a drug to treat that, right? We've got drugs out there, and natural measures too, that just treat cholesterol. But you know what? It obviously hasn't made a difference, or much of a difference, because it's still the #1 killer. And yet these cholesterol-lowering medications are out there and pushed on every consumer and all of my patients constantly by the drug companies.
So it's not that you don't prescribe drugs, it's that you would rather give the body its best chance to heal itself.
Absolutely.
Before you recommend drugs or surgery.
That's correct. The drug companies understand this about the drug companies. They make drugs that they expect you to take the rest of your life. They make lifestyle drugs. They want to give you a drug that you take the rest of your life. And granted, they don't want you to die too young either.
Right, and they don't want to cure it either.
They don't want to cure it. No, if they cure it, they can't keep selling you the drug. They want you to stay sick and suffering for a long period of time and take their drugs. Now, if you look at the Physician's Desk Reference, which is a book about this big, and every physician has it in their office, and I get sent one every year, it has an A to Z of every drug that's out there. Now, almost every one of those drugs is a lifestyle drug. It isn't a cure. See, drug companies don't make cures.
What are people supposed to do, though? I interview a lot of medical doctors, a lot of alternative health doctors, and they all say, oh, you got to eat fruits and vegetables. Stay away from cholesterol.
The jury's back on this. We really now understand what you need to do to lower your risk for coronary disease and sudden cardiac death. And these are the endpoints that we're really concerned about. We're really not so much concerned with what the numbers are anymore. It's really whether your quality of life is better and whether you live longer. This is what's really important. And the way that we focus in on this and do something about it is, #1, we have to reduce the amount of total saturated fat in the diet. And that's the fat that's hard at room temperature, lard, butter, things like that.
I see all the foods now coming out, no saturated fat.
We just need to reduce that a little bit. But in conjunction with that, obviously exercising, being a little more physically active,